Welcome to Body Talks Health, where we explore the hidden mechanisms of the human body and the diseases that affect us. Today we are diving deep into the protective layers of your brain, specifically looking at the condition known as viral meningitis. Your brain and spinal cord are shielded by three tissue layers called meninges: the delicate pia, arachnoid, and durable durameter. Between these protective layers flows the cerebrospinal fluid, a cushion that keeps your central nervous system safe from sudden physical impacts. However, this fortress is not impenetrable, as microscopic invaders can sometimes breach the walls, leading to inflammation within these vital tissues. Viral meningitis is the most common form of this disease, often less severe than bacterial types, but still requiring medical attention. The primary culprits behind most cases are non-polio enteroviruses, which are quite common and can be found in many everyday environments. Other potential viral causes include the mumps, measles, and herpes viruses, all of which have the capacity to infect the meninges. Nature also plays a role, as viruses carried by insects like mosquitoes and ticks can transmit this infection directly to humans. Transmission often occurs through poor hygiene, specifically when traces of stool remain on hands after using the bathroom or changing diapers. Respiratory secretions are another major pathway, where tiny droplets from a cough or sneeze carry the virus from person to person. You might contract the virus by touching contaminated surfaces like doorknobs or toys, then inadvertently touching your eyes, nose, or mouth. In specific seasons and regions, the bite of an infected mosquito or tick introduces the viral pathogen directly into your bloodstream. Once inside the body, the virus begins to multiply and travel through the bloodstream, searching for a way to the brain. The critical moment occurs when the virus successfully crosses the blood-brain barrier, infiltrating the cerebrospinal fluid surrounding your brain and spine. Your immune system detects the intruder and launches an attack, causing the meninges to become inflamed, which triggers the painful symptoms. Identifying symptoms in infants is challenging, but look for high fever, extreme irritability, and a distinct lack of appetite during feedings. Another alarming sign in young babies is lethargy, where the child seems difficult to wake up or appears unusually sleepy constantly. In adults, the symptoms are more specific and often start with a severe headache that does not go away with rest. A hallmark sign of meningitis is a stiff neck, making it very painful or impossible to lower your chin to chest. Patients often experience photophobia, which is an extreme sensitivity to bright lights, along with feelings of nausea and occasional vomiting episodes. If you suspect meningitis, medical diagnosis is crucial, often involving a lumbar puncture to test the spinal fluid for specific viruses. The good news is that most cases of viral meningitis are not fatal, and people typically recover within 7 to 14 days. Antibiotics do not help viral infections, so treatment focuses on rest, hydration, and allowing the immune system to fight the virus. Doctors may recommend over-the-counter medications like acetaminophen to help manage the fever and reduce the severe body aches and headaches. In specific cases caused by the herpes virus or influenza, a doctor might prescribe specialized antiviral medications to speed up recovery. Prevention is always better than cure, so maintain good hygiene by washing hands thoroughly with soap, especially before eating or cooking. Staying up to date with vaccinations for measles, mumps, and chickenpox can significantly lower the risk of developing viral meningitis complications. Protect yourself from insect bites by using effective repellents and wearing long sleeves when in areas known for mosquitoes and ticks. Thank you for watching this detailed guide on viral meningitis. Stay healthy and subscribe to Body Talks Health for more insights.